I'm so glad you're here. This is a replay of a live training I did inside the OTs for Pelvic Health Facebook group with Lindsay Vestal, and I wanted to make sure that everyone gets access to it. Pelvic health is such an incredibly fulfilling specialty, and it's growing so much. I've been training OT since 2018, and my goal is to have over 10,000 OTs trained by the year 2030. I'm so glad you're here learning about this specialty. I hope that you can join us in the OTs for Pelvic Health Facebook group with me, Lindsay Vestal. I will link to the group below in the show notes and description. Thank you so much.
Right. Welcome, everyone. I hope everyone's day is off to a great start. I know my mug of tea has not been far from me all day as Lexi's reaching for her water. We are all trying to keep immune systems high, energy high. Cheers, Susan. Jessica, I know you had your green tea available a moment ago. I am so excited to be able to speak with you all today about your incredible, and I do not say that at all unenthusiastically, your incredible talks that you'll be sharing with us at the third annual OTs and Pelvic Health Summit happening August 17th and 18th. Thank you so much. I am going to share your topic titles, and then we're just going to kind of roll up our sleeves and talk a little bit about what it is you will be sharing with us. Susan Clinton, I am thrilled that you're going to be joining us this year in Phoenix. Your topic is IBS and bloating distension, linking evidence for optimal interventions. And Lexi and Jessica, you're going to be talking about respecting your rhythm, using menstrual cycles to empower clients, support occupations, and optimize roles and routines. I am so excited. Oh, let's kick it off, Susan. Why is your topic important? Talk to us a little bit about what you hope to share with us at the summit.
Awesome. I think one of the hardest or the most complicated clients that people run into are people with complex GI issues. And the biggest complaint that clients have is bloating and distension. And so we really need to tackle this head on and really start looking at how we can look at a systems approach to really combat this. Everybody just looks right at the stomach and right at the gut and right at this. And there's so many integrative ways that we can bring this whole system back into line. And it has everything to do with how our diaphragm works in combination with things like IBS and chronic low back pain, which actually walk hand in hand, as everybody knows. But looking at how these pressure systems are managed and what's really going on up at the top of the pressure system, what's happening at the area of the diaphragm, and why the abdomen is allowing all this gas to build up and not working like it should, which it should slightly contract to help us move the gas through. But with people with abdominal bloating and distension, it does just the opposite. So how do we reverse that dysenergic type of presentation? And what can we do to get our clients so much more comfortable so that they can actually be empowered to kind of take charge of the situation and know what they can do and be really empowered to move forward with confidence?
Oh, such an incredible topic, such an important cornerstone of pelvic health. And
Mhm.
you're right, we all have those clients that were like, what next? What else can we do? So I'm thrilled. I'm so excited to be able to learn from you, Susan, at the summit. So thank you for
Mhm.
talking to us and coming to us live so we can all learn and have these discussions. Lexi and Jessica, talk to me. Tell me a little bit about respect your rhythm.
Well, so Jess and I wanted to, we are just so passionate about this topic, in our personal lives, but also the connection it has to pelvic health, and especially for those of us working with women in pelvic health. Um, many of you probably know that the menstrual cycles are like the fifth vital sign. And ACOG and the World Health Organization, I think now even like the American Academy of Pediatrics is saying, like, for the mothers of these children, that menstrual cycles need to be looked at in addition to body temperature, pulse, respiratory rate, all that, because they can indicate not only imbalances and illness, but also what else can they show us, right? We know as OTs that, we can look at other signs to figure out how somebody is going to function, right? So we're looking at these signs that are like when we begin menstruating the first time, the other 400, however many times we're going to menstruate in our lives as women, when we become pregnant, when we ovulate to try to become pregnant or avoid it, when we're going through perimenopause and menopause. All of these points in our lives have these changes that we go through that indicate not just imbalance and illness, but also things like, what is our physical energy going to be like? What's our mood going to be like? How are we going to relate to the people around us? How are we going to experience pain and other sensory inputs? What kind of movement do we crave or would we really benefit from? To avoid injury or to really build strength when that's something that's important to us. And, also what kind of foods do we need at different points in our cycles to support our bodies? And so what Jess and I are super excited about is educating other OTs to begin to about menstrual cycles and also tracking menstrual cycles so that we know how to do it for ourselves, which actually I think is pretty fun. But also we start collecting this data about ourselves, our like own individual unique body of evidence that we can then use to empower I mean, we do it for ourselves. We can then feel confident introducing it to our clients. And I feel like this is a theme of the conversation is empowerment. Empower our clients to do that for themselves and make informed decisions about changes that could support their routines and their participation or their choice not to participate, depending on where they are in their cycle and just their overall function in all the multifaceted roles that they have. So we're just so passionate about it, and we're so excited to share it with other pelvic health practitioners at the summit this year so that they can share it with their clients.
Yes, just to piggyback off of Lexi, we're also not taught these things. And I feel like when you talk to other pelvic floor therapists, we know it's important, but we don't know how to have these conversations. What does it mean if they're on birth control? What does it mean if their cycle's 24 days and not 30? Or what do these things mean? And so we're hoping to give everyone who shows up and watches, later information that they can take to their clients and that they can also, hopefully you'll change some of your habits, even how you treat as a pelvic health therapist, knowing, we're not like this and this is normal. So we're obviously very excited.
Both of these topics are things that, yeah, when we bring into the consciousness of not only how we can adapt them to our own lives and optimize our own health habits, but again, yeah, how do we deepen those conversations in a pelvic health setting? And so both of these, I feel like both of these topics really ring true to that. And I'm really looking forward to kind of diving into the depth and that passion that I feel from all three of you. Susan, I'd love to hear from you. What are you looking forward to the most regarding the summit?
Oh, I love going to things like this. The biggest thing I look forward to is the connections. Meeting awesome people like Lexi and Jessica, being able to trade stories, talk about things, where they got their information from, where everybody is coming from, what they're doing, what they're passionate about. I think we all walk away from these types of conferences and summits much better clinicians, but also importantly, much better friends and associates. Just because there's nothing like an in-person, in place, everybody together, really changing ideas. Just the vibe is always so good at these things. And I'm super excited. I'm super excited to be there.
I can't wait to meet you in person. And Lexi and Jess, both of you, I got to hug you last year. You were both at the summit. Jess talked with us about nutrition and pelvic health. So you guys are return veterans. What are you two looking forward to the most at the summit this year?
Well, I'm excited about Susan's topic because she's speaking true to my heart. I love digestive health. I love complicated GI patients. So I'm super excited, like Susan said, to just learn from everyone else. I can't tell you how many little nuggets I took away from last year. Just little things where I'm thinking about Danica's presentation or the pelvic bowl meditation by Lynn Schulte. Like these little things, because they were short, but also so impactful, I'm just excited to grow and also be with the coolest people in the universe.
Oh, I hope this isn't taken as a cop out, but ditto to both of you guys. I mean, yeah, learning, it's like 50-50. Like what I'm going to learn, I know it's going to be incredible. Like Jess said, just all those little nuggets, but then the connections, reconnecting with people I haven't seen since last year, making new connections. And Susan, I know you haven't been to the summit yet, but you're totally right. Like the vibe is everybody was just sort of like humming with good vibes. So just looking forward to being together with everybody again.
Fantastic. Tickets open February 1st and it's early bird through February 28th, which means you get $100 off your registration and you also get to choose your lab. So we have 6 labs over 2 days. It is first come, first serve. So when you sign up early, you get to pick which lab you want to experience hands-on because of course you get access to lifetime access to all the recordings. So you will definitely get a chance to learn from everyone, but the chance to pick hands-on experience is what that early bird window is offering. Weslina is joining us. She said she can't wait for the vibe. She's so excited. We all can't wait. So thank you, Jess. Thank you, Susan. Thank you, Lexi, for joining me today and sharing with us just a little sneak peek into what we'll be learning from you. And of course, the passion that we're all going to share together. So everyone have a beautiful rest of the day. So grateful for you all.
Bye. Thank you so much.